thoracic injuries for the fmge. X-ray will be the choice of investigation in any kind of blunt injury to the thorax. ठीक, most common complication after blunt injury to the thorax is rib fractures. Then you need to identify cardiac tamponade and tension pneumothorax. In tension pneumothorax, you will get the mediastinal shift, resonant on percussion, and absent breath sound. And you will get the hypotension and neck engorged vein in both cases. Okay. So in tension pneumothorax, you need to insert wide bore needle in second intercostal space at the mid-clavicular line. Okay. And these both are diagnosed clinically. For cardiac tamponade, you will get backstride, which include first hypotension, neck vein engorgement, and muffled heart sound. Okay. Then you need to know about flial chest. You need to know its diagnosis, its definition, and its treatment. In treatment plan, if it is not severe, then you can just give him analgesic to the local area or systemic. Then do the ABG, repeat the ABG. And if it is in severe condition, like he got respiratory compromised, then you need to do endotracheal intubation with positive peak ventilation, IPPV. Yes, this is what you need to know. First line treatment is to administer oxygen and analgesic. And flial chest is diagnosed clinically. Best approach in thoracic trauma for the incision is left anterolateral thoracotomy. This is all. In lower rib fractures, you will get the abdominal solid viscera injuries like liver, spleen. But in the upper rib fracture, you will get the vessel injuries. And you also need to remember the indication of thoracotomy after blunt trauma. Emergency thoracotomy is indicated after chest trauma in following condition. First, cardiac arrest, a massive hemothorax, greater than 1.5 liter of blood through the chest tube acutely, or greater than 200 to 300 ml per hour for 3 hours. Third one is penetrating injury of the anterior aspect of the chest with cardiac tamponade. Fourth, large open wounds of the thoracic cage. Fifth, major thoracic vessel injury in the presence of dynamic instability. Sixth, major tracheobrachial injuries. 7th, evidence of esophageal perforation. 8, massive air leak. 9th, cardiac tamponade if needle aspiration is unsuccessful. Approximately 90% of cases are associated with cancerous tumor that is compressing the superior vena cava, such as bronchogenic carcinoma, including small cell carcinoma mainly, and non-small cell lung carcinoma, Burkitt lymphoma, lymphoblastic lymphoma, pre-T-cell lineage, acute lymphoblastic leukemia rare, and other acute leukemias. So squamous cell carcinoma mainly related to the superior vena cava syndrome. An intercostal tube is placed in 6th intercostal space in mid-axillary line for pneumothorax and pylothorax, whereas in 3rd or 4th space in mid-axillary line for the pneumothorax.